Hello and welcome back to NCLEX Made Simple YouTube channel. Here we give you content to help you pass the NCLEX within the very first attempt. Last time we discussed about Myasthenia gravis. We said this is an autoimmune disorder where autoantibodies produced from the thymus gland go and attack the receptor sites at the neuromuscular junction, receptor for the acetylcholine. We said acetylcholine is a neurotransmitter that will help at the neuromuscular junction with muscle contraction. So when there is damage to receptor sites, when they are destroyed, there will be no stimulation or very minimal stimulation, and this causes muscle weakness, what will now lead to a patient going into Myasthenia crisis. So also in cholinergic crisis, it happens due to excessive stimulation of the receptors at the neuromuscular junction by acetylcholine, which eventually leads to muscle weakness and respiratory failure. So what are we saying? We are saying that when the patient is having a condition called myasthenia gravis, due to that damage at the receptor site, something needs to be done. And we tackled in pharmacology that the patient needs anticholinesterase drugs and also the immunosuppressive agents like azathioprine and prednisolone, and anticholinesterase drugs such as neostigmine and peridostigmine. Sometimes you can give an overdose of these drugs, and this what will lead to cholinergic crisis. When there is an underdose or under medication of these drugs, it is when the patient will experience a myasthenic crisis. Let us now proceed and look at myasthenic crisis and cholinergic crisis. Let us try to differentiate. In myasthenic crisis, we have said it happens because of under-medication of these cholinesterase drugs such as neostigmine and peridostigmine. In cholinergic crisis, it happens because of over-medication leading to overstimulation. So that is one way to differentiate that. And now the other thing about myasthenic crisis, there is temporary improvement of symptoms with administration of endrophonium. Endrophonium is also called tensilon, and we discussed it in tensilon test, whereby when you administer this medicine, it can lead to increased muscle strength. So when you administer it in myasthenia crisis, muscle strength increases. There is temporary improvement of symptoms with administration of tensilon or endrophonium. In cholinergic crisis, the symptoms worsen with endrophonium, but they improve with administration of anticholinergic drugs such as atropine. So atropine sulfate is given as an antidote to anticholinesterase drugs such as neostigmine and peridostigmine. So when you give atropine, the condition improves in cholinergic crisis. Heart rate will be increased in myasthenic crisis, but it will be decreased in cholinergic crisis. There will be respiratory distress in myasthenic crisis, and cholinergic crisis, you could have abdominal cramps. In pupils dilate in myasthenic crisis, what is also known as mydriasis. That is pupil dilatation. But in cholinergic crisis, pupils constrict. What we say is miosis, pupil constriction. That is very important to note. The other thing is blood pressure. It is increased in myasthenic crisis, while in cholinergic crisis, the blood pressure is decreased, mostly due to vasodilation. There will be normal secretions in myasthenic crisis, but in cholinergic crisis, there is increased secretions, excessive salivation. There will be increased bronchial secretions. So in cholinergic crisis, the secretions are increased. So now let us look at a few SATA questions that can be brought in NCLEX. We just want you to understand the symptoms associated with myasthenic crisis and cholinergic crisis. So the first question is a SATA question. Select all that apply. Signs and symptoms associated with myasthenic crisis. There is pupil dilatation. There is muscle fasciculation, meiosis, bowel and bladder incontinence, negative gag and cough reflex, respiratory failure, and bradycardia. So which ones would you select to belong to myasthenic crisis? So the answers are A, D, E, and F. A is pupil dilatation. Pupil dilatation, we said in mydriasis, is found in myasthenic crisis. Then there will be bowel and bladder incontinence. That is also in the myasthenic crisis. Then there will be negative gag or cough reflex, also found in myasthenic crisis. Then there will be respiratory failure. Another SATA question on cholinergic crisis, you will find that you can be able now to select the answers that show signs and symptoms associated with cholinergic crisis. A, meiosis. Meiosis is pupil constriction. Is that right? Yes. So dry mouth. Remember, in cholinergic crisis, we have a lot of secretions. So is it true? No. Blurred vision. Yes, blurred vision is also found in cholinergic crisis. Is a symptom of cholinergic crisis. Muscle fasciculation is also a symptom of cholinergic crisis. Diarrhea and abdominal cramping is also a sign and symptom of cholinergic crisis. And also respiratory failure. So here the answers are A, meiosis, C, blurred vision, E, muscle fasciculation, F, diarrhea and abdominal cramping, and also there will be respiratory failure. Very, very important to note the difference between myasthenic crisis and cholinergic crisis for your NCLEX exam. This is a question that can be brought in nursing care study, and these are the questions that help you pass the NCLEX. So just understanding what is involved in myasthenic crisis and cholinergic crisis is very, very important for your exam preparation. So we have come to the end of this topic, myasthenia crisis versus cholinergic crisis as a complication of myasthenia gravis. If you have not subscribed to our NCLEX Made Simple YouTube channel, this is your chance. Go there and subscribe. Why is this important? It will help you get notification for every video we upload. Any video we publish on our YouTube channel, you'll be the first one to get that video. Go there and subscribe, and let's meet again in our next topic, and thank you for being with us.